I know there's probably different levels of vaccine injuries. I'm sure
Mhm.
it depends on how many boosters you went and got. I'm
For sure.
sure it depends on your lifestyle outside of just getting that
Yeah.
chemical injected into you. Can you you can't cure it, like, it's in your body now, but to what level can you manage the idea that, this could injure and has injured a lot of people?
Mhm.
How how effective are you guys at getting that under control?
So I personally have been treating vaccine injury in my clinic for a year and a half now. I started seeing an incredible amount of vaccine injury in April of May of last year. It was like my world was like Twilight Zone. Every day I was having multiple patients coming in. It was like these things that were more that were previously rare. I was seeing them all the time, and I realized what was happening.
Like what?
It like strokes in a 44-year-old
Yeah.
and transverse myelitis in a 36-year-old and like all of
Mm,
these things that were very rare before. I was seeing so many blood clots. I was seeing
mhm.
menstrual irregularities. And once I was able to identify all these patterns, which is the way physicians are supposed to work, right? They're supposed to be able to assess what they're seeing on the ground and be able
Mhm.
to either make assessments based off of their own observation or being able to talk to other physicians about it. And because of censorship, physicians were kept from really talking about it. They couldn't even talk about it in the physician lounge or in the hallway because it was taboo to be able to say, oh, I think that this stroke is from having the vaccine last week. They weren't even allowed to say that. And so
That's insane.
so I've been treating this for a long time and um developing protocols. And now we've worked with the chief medical team to develop protocols as a group. And so and we've also discussed it with world renowned experts that we have, relationships with. And these protocols, basically, we're working to target the inflammation, to neutralize the spike protein, to target nutritional needs that can help with reducing inflammation or that may be common with these types of energy or with these types of injuries. And
Mhm.
so, because of these different protocols, we hope to alleviate the effects of the vaccine, although we know that we we don't yet know. We know that we don't yet know
Yep.
when the spike protein is no longer being produced. So all of the
You
studies showed at this point that when they stop the study, the spike protein is still being produced months after getting the
mm.
vax. And
So
so,
after you've gotten the vaccine or a booster or 2
mhm,
boosters or 8 boosters,
mhm,
the spike protein is still there, it's still active, it's still
yes.
reproducing, but at some point it will stop? At
So
some point?
we don't know,
You don't
honestly.
know.
We know that it's
Okay.
still hanging out. It's in the lymph tissue. We find it in all sorts of areas of the body. And also the lipid nanoparticle. Here's a whole separate thing. So the vaccine is composed of a genetic sequence and encompassed or encapsulated by the lipid nanoparticle, which is like a fat. And so
Okay.
that is how it gets into your cells. And so it slips through your cell membrane because of that lipid nanoparticle covering. It was designed to do that. And if you think about it, the craziness of the fact that they designed it to be able to slip through all the different cell types, well,
Yeah.
what we found out is that that lipid nanoparticle likes to go accumulate in the brain, in the bone marrow, in the ovaries, the testes. It's the first vaccine in history that goes to the brain. And they know that. That's how they
Mhm.
designed it. So no other vaccines before would go to the brain, but they designed it to be able to slip through the blood-brain barrier, go to all the different cells. And so not only does the spike protein cause incredible inflammation, but the lipid nanoparticle itself causes incredible inflammation. This is probably one of the reasons why we're seeing so much problems with menstrual irregularities. That lipid
Mhm.
nanoparticle is going and accumulating in the ovaries and wreaking all sorts of havoc and creating inflammation. And we don't really know how long it sticks around or how much damage it's doing. It's also going into the bone marrow, creating inflammation. And also, the spike protein itself, because it's so inflammatory, we know all the dirty things that the spike protein does, and it affects your body's own mechanisms for cancer prevention. That spike protein does. It affects the
Wow.
p53 molecule that helps inhibit cancer. It's like our guardian of the genome.
It
It affects
destroys it, it messes with it.
it messes
So
with
then now
it.
you're more so people are more prone to cancer
Yes,
now.
that's correct. More
And
prone to cancer for multiple reasons.
and when you say that it's going into your fat cells and your brain cells and your is it going in there and it's staying? That's it? You can't get it back out?
So I think
Like
that the lipid nanoparticle will degrade. I don't know how long the spike protein gets produced. We do know, I don't know if you noticed, but at the beginning, the CDC was saying that there was no evidence that the mRNA would affect our DNA. We knew
right.
that was a lie because
Yeah.
you have this enzyme called reverse transcriptase, which can take RNA and transcribe it backwards into DNA. And then that DNA can be floating around and get incorporated. But we had a study that came out, I think it's been 7 or 8 months now, that they showed that that genetic sequence transcribes backwards into DNA and it incorporated into liver cells, hepatocytes. And
Oh my
so
gosh.
and so then they took that off the CDC. I do believe is the CDC's website that they changed. So now they can't say it doesn't change our DNA.
They're changing their mind? No.
Yeah,
They
right.
lied in the beginning? No.